A migraine is classified as a unique and unfortunately horrible type of headache that can create nausea, vomiting, and even sensitivity to light. Most migraines last anywhere from 3 hours up to 4 days in duration. The American Foundation for Migraines also states that 36 million Americans in America alone suffer from regular migraines. Women are actually 3 times more likely to deal with migraines than men, and the most common ages tends to vary from about age 10 to age 40. So really the early part of life, 90% of people who deal with migraines, and if you're watching this and dealing with a migraine or deal with migraines, you'll know that it certainly interferes with your day-to-day life, your day-to-day function, whether that's work or everyday activities. Doctors don't know the exact cause of most people's migraines, although the most current research shows there's a correlation with neurological interference from the brain. Most commonly, patients with migraines get prescribed migraine medications, often though with subpar results and always with the risk of side effects and other ill health effects when it comes to taking these medications. One option that people have, which unfortunately is not used enough, is getting evaluated by a neurologically focused chiropractor. You know, I love to reference this particular study that was actually done by Complementary Therapies in the edition of Medicine. This was done in 2015, and it was a study that looked at spinal adjustments through specific neurologically focused chiropractic care actually provided better long-term health compared to use of migraine medication. And what I really love about this, if you check this out, patients who received upper cervical manual chiropractic adjustment care, right? So that is mean we're focusing, when we talk about the upper cervical spine, we're talking about the top vertebrae in the neck. That is where by far the most nerve endings are. Brainstem, the most sensitive area neurologically. Patients who receive that type of care reduce drug consumption by 80%, days of migraines per month by 97%, and pain and functional disability associated with migraines by 100%. So it was an amazing study that looked at, and it was a randomized controlled trial that looked at patients getting specific neurologically focused upper cervical care, which is the care that we provide here in our office, had significant improvement with migraine headaches. So when patients come in and they're maybe dealing with migraine in particular, of course we look at their history, we look at what's going on exactly, what they've done for care in the past, but we always look at the structure. If we find vertebral misalignment especially in the upper neck, 100% of the time it will lead to neurological interference, which, as I shared with you, is a direct correlation with migraines and headaches. So if you're watching this and you've come to our website, you've come to this video, you've come to our page because you're curious on how we may be able to help you with migraines. If you've tried other doctors, you've tried medications, even other chiropractors, what we do here in our office is different than most. We're gonna take the time to do neurological testing through the form of thermography. That's gonna scan the spine and look at any nerve interference that will be detected through an inflammatory measurement. We also will do spinal analysis through digital x-ray to really be able to evaluate structurally where there may be misalignments creating nerve pressure. So let us know how we could serve you. I look forward to it. We do not do adjustments or anything to your spine before we thoroughly understand what may be causing the issue, or in this case, the migraine.